Since LASIK was approved 20 years ago, there's been over 19 million procedures performed here in the United States. There's also been over 6,000 peer-reviewed studies, which makes LASIK the safest and most studied elective surgical procedure that medical science has ever given to mankind. So I decided it was time for me to put my money where my mouth is. This July 2019 marks the 20th anniversary of the FDA approval of LASIK. So to celebrate this, the Refractive Surgery Alliance has deemed July Vision Correction Month. So the entire month of July, eye surgeons and optometrists from around the world are having LASIK or other vision correction procedures on their own eyes. Surgeons from all around the world are going to be performing surgeries on other eye surgeons. But for me, I'm actually going to be a patient. So I'm going to have my father, Charles Williamson, who's been a vision correction specialist here in Louisiana for the past 40 years. He's going to be performing my LASIK surgery. So I'm nearsighted, which means I'm very good at things close up. So when I'm operating, it's fantastic, and I'm looking through oculars that makes it even better. And the oculars that I use in surgery can actually be adjusted with my refraction or my prescription. So I can operate just fine. But when I'm outside of the operating room, when I'm in my everyday life, my vision just isn't quite as good for a distance. So things like driving, that type of thing, is very difficult for me. I just don't really like contacts. I didn't want to be in glasses, so I thought now was time. And with the introduction of the iDesign 2.0 from Johnson & Johnson, I've seen such excellent outcomes with my patients, literally better than 2020, 2015, 2010, what we call superhuman vision. We're seeing that more and more, and that got me really excited. I said, now's time for me.
Open real wide and hold it.
One of the coolest things about the iDesign system is it uses the Shack-Hartman system in order to provide an exact 3D map of the cornea and of the entire wavefront of the eye. And this is the same exact system that they're using in the James Webb Space Telescope for NASA. So we're using space-age technology in order to treat you for your LASIK procedure. For the past several years, I've been treating patients with LASIK and other vision correction surgery procedures. It's very different being on the other side.
The laser to the right of us basically is to treat correction. The laser to the left is to do the LASIK flap, basically. We'll use both lasers during the procedure. We'll start off doing the flaps first, and then we'll do the treatments second. In this part, we lift the flap actually that we just created. We'll lift the flap. 20 seconds worth of treatment. Okay, guess we can have lights, camera action again. So here we go.
Take this patch off?
Yes, I'll take all of this off, blink a little bit.
All right.
And you can sit up. The ladies are gonna be there.
All right, I can see.
There's your wife to the left. Pick the...
I can see. That's pretty wild. That's great.
My pleasure. There we go.
Great.
So whenever I sat up off the LASIK table, you really don't feel any pain at all. You still have all the numbing drops working. You're feeling great. I went and sat in an exam room for a few minutes just to kind of rest with my eyes closed. Again, felt great. Could already see letters on the eye chart. Things are still blurry, but you could actually start to make out some vision. By the time I got home, I started to feel like I had eye surgery an hour ago. I think the biggest symptom I had was tearing. So I had a lot of tearing, and I just felt more comfortable keeping my eyes closed. So what I did is immediately started using my antibiotic and steroid drops, as well as the comfort tears that we give you, and that made it 1,000 times better. The comfort tears kind of give you some temporary relief. I was able to take a nap, and by the time I woke up, it was dinner time, and I was feeling a lot better. On day one, I was seeing 2015 with both eyes open, and as of this morning, I'm still seeing 2015. Very, very excited about that. So what's cool about it is being able to see street signs way far away, being able to read license plates, little things like that I just would try to squint and see previously. Now I can just flat out see. So my vision is excellent in terms of the clarity. The biggest thing I'm getting used to is the lights. So driving during the day and even driving at night, I'm getting used to headlights and things like that. That's going to take some getting used to over the next several weeks. But overall, the colors, the clarity of my vision, and not having to squint anymore is really exciting.